Hello. Let us now know what exactly are subarachnoid cisterns. You know, brain and spinal cord is surrounded by meninges. The outer layer, the tough layer is dura mater. Then you have arachnoid matter, and closely adherent to the surface of the brain and spinal cord is the pia mater. The space between dura and arachnoid is called subdural space. The space between arachnoid and pia mater is called subarachnoid space. So, at some areas of the brain and the spinal cord, this subarachnoid space becomes dilated, and that dilated space forms the subarachnoid cisterns. What is their function? The function of these cisterns is it contains pool of cerebrospinal fluid. It acts like a water bed for the surrounding brain tissue. It acts like a shock absorber. And the pulsations of the arteries present within the cistern helps to force the cerebrospinal fluid to reach the superolateral surface of the cerebrum and finally into the arachnoid villi and arachnoid granulations for absorption. So, those are the functions. Now, where exactly these cisterns are present, at which area of the nervous system these cisterns are present? So, basically there are 5 or 6 cisterns. To start with, I will go with the first, that is cerebello-medullary cistern. This is the largest cistern in the brain, hence it is also called, anything which is larger is also called magna. So, it is cisterna magna. Name itself is saying something, it is present between the cerebello-medullary cistern. So, this is that cistern, this region is that cistern, which lies along the inferior angle of cerebellum and posterior aspect of the medulla oblongata, lying in the angle between the cerebellum, medulla oblongata and occipital bone behind. So, that cistern we call it as, this one is now the cerebello-medullary cistern or cisterna magna. Clear? This cistern on sagittal section, it is somewhat triangular in shape. It is continuous inferiorly with the subarachnoid space along the posterior aspect of the spinal cord, and it is the only cistern which is in direct axis with the ventricle, because it communicates, this fourth ventricle is communicating with this through the apertures in the roof of the fourth ventricle, that is paired foramen of Luschka, and this gap what you are seeing, it is the unpaired foramen of Magendie. And what it contains? It contains branches of, some branches of vertebral arteries. Is it clear? So, this is all about the cerebello-medullary cistern. Now, coming to the next cistern, which is cisterna pontis or pontine cistern. It is the cistern which is present along the ventral aspect of the pons. This is a pons. So, in front of it, this is that cistern, cisterna pontis. You see the dilatation of the subarachnoid space resulting into the pontine cistern, and this cistern contains the basilar artery. This cistern is located over the clivus of the occipital bone and contains the basilar artery. Next one is interpeduncular cistern, which also is called as the basal cistern. Interpeduncular cistern or basal cistern. It is seen along the base of the brain. In between the two temporal lobes, within the interpeduncular fossa, that means here this one, and it is also called basal cistern or interpeduncular cistern, and contains the arterial circle of Willis or circulus arteriosus within it. Okay. Now coming to the fourth one, this is Sylvian cistern or cistern of lateral sulcus. So if you see the here on the surface of the brain, there is a cistern called in front of the temporal pole and within the stem of the lateral sulcus here. This is the stem of the lateral sulcus and this is the temporal pore. Here you find a cistern which is called as Sylvian cistern or cistern of lateral sulcus containing the middle cerebral artery. Is it clear? And the fifth one here we call it as cisterna ambiens or cistern of great cerebral vein of Galen. Cisterna ambiens or cistern of great cerebral vein of Galen, which is present below the splenium of corpus callosum and superior surface of cerebellum here. This is that cistern. This cistern we call it as cisterna ambiens or cisterna of or cistern of great cerebral vein of Galen, and it contains a vein. The content is great cerebral vein of Galen here. It contains great cerebral vein of Galen, great cerebral vein of Galen, pineal gland, and it forms an important neurological landmark for the neurosurgical or neurological land. This region forms an important landmark. Then a cistern which is not in relation to the brain, but if you go further downwards over the spinal cord, you can see the subarachnoid space below the termination of the spinal cord around the phylum terminale at the level of L3, L4 is dilated, and that we call it as lumbar cistern. This lumbar cistern is the region which is often selected to draw the cerebrospinal fluid or to do the lumbar puncture. When that lumbar puncture is not made possible, the other way to draw the cerebrospinal fluid is doing the cisternal puncture. This one, doing the cisternal puncture. That means passing a needle from the back of the neck through the suboccipital triangle by piercing the posterior atlanto-occipital membrane, which lies between the foramen magnum and posterior lamina of the atlas, passing the needle anteriorly and superiorly, wherein you reach this region of cerebellomedullary cistern where the CSF can be drawn from there, and that we call it as the cisternal puncture. This is in brief about a small topic called subarachnoid cisterns. Thank you.